Good evening, everyone. I want to welcome everyone that's in attendance here to our workshop this evening from Pittsburgh Medicare 101. It is our Medicare Made Simple educational workshop. I'm your presenter this evening, Bill Cardos. And again, I want to welcome everybody here. Normally, what we are used to doing, except for the last year or so, is we normally go out and give these presentations in local libraries, community centers, and we get to know the audience. We get to chat with you and talk with you a little bit. So just so we get to know you a little bit better, if you could go ahead and type your name in the chat area there, say hello, and that way I'll know that you're all here, because we do have quite a few people that have signed up this evening. And while everybody's saying hello, then we will know that everybody's here, and we will get started. Hi, Alice. Thanks for joining us this evening. Hi, Joe. I'm glad that you could be here. Bob, we're really glad that you could make it to our workshop this evening. We're really glad everybody that is here, and hope you're ready to learn a lot about Medicare this evening. Hi, Michelle. Glad to see you. Okay, so we're a little bit past 6 o'clock. We do still have some people logging in. Hi, Mary. Glad that you're here with us. But, you people were here on time. I like punctuality. So we're going to get the workshop started for those people that are here. And before we jump over that, I do want to say hi to Brad, because he said hello as well. So again, this is our Pittsburgh Medicare 101 Medicare Made Simple workshop. And just so that you know when you're in the right place, I'm going to go over the things that we're going to cover for you today. So what we're going to go over first is Medicare Part A and B. That's original Medicare. We're going to review Medicare Part C, which is our Medicare Advantage plans. Then we're going to go over Medicare Part D, which is the drug plans. And we're going to go over Medicare Supplements, or Medigap plans. And probably most importantly, we're going to review with you how to get help when you need it. So I know Medicare is confusing, and there's all these terms, all this mail you're getting, all the TV commercials, and they're still running now. It's just a ton of confusion. When we were out doing these workshops live, we had a lady come up to us and bring us her mail. Okay, and that was just from the week before the workshop. There's about 20 pieces here. Some of it looks official, but there's a lot here, and we understand that it can be confusing, and we're here to help you clear up that confusion this evening. Okay, so we need to get this important disclaimer out of the way first. We want to let you know that this event is for educational purposes only. We're not going to be going over any plan-specific benefits. We're not going to be going over details of any particular plan. So myself, Bill Cardos, and the team here at Pittsburgh Medicare 101, we're not connected with the U.S. government or endorsed by the federal Medicare program. But with that being said, what we are insurance and financial advisors. We've been in Western Pennsylvania a long time. We probably have more than 100 years of experience in the Medicare arena with all of the advisors we have here. Okay, and I want to also let you know that we're not going to be trying to sell you anything tonight. So I just want you to sit back, relax, and learn. So we saw a need for this because one of the things with the clients we work with, what we found is Medicare was one of the most confusing things they had to deal with when they were leaving employment, going into retirement. And it's also one of those things, if you make the wrong decision, don't do something at the right time, it could cost you for the rest of your life. Okay, so the things that we're going to share in the workshop tonight, we've discovered in all those years' experience. And what we like to say is we've seen the good, the bad, and the ugly, and we're going to try to steer you away from the bad and the ugly and get you on the path to good. One more thing before I jump into it a lot further. What we normally do when we're live and in front of people, we'll let you ask questions throughout the workshop. We want to make sure you understand what we found in these virtual workshops that doesn't work very well. So if you hold your questions till the end, if you come across something that I say and you want to write it down, we're going to give you all the time you need at the end of the workshop to ask questions, and we'll be glad to answer those. Okay, so we're going to jump into Medicare now. So most of you, if you're coming right up on 65 within 3 or 4 months, you should have received this book, Medicare and You. We used to be pretty certain that people were going to get it about 3 months before their 65th birthday, but since the last year, that has all changed. We've had some people get it 5 months before. We've had some people get it, 6 weeks after they turned 65 and made their Medicare decision. It wasn't very helpful to them, but it's a nice, big, thick book. It has everything you want to know about Medicare in it, but it is 128 pages, packed full of information. The problem there is it's written by somebody with the government, so it's not always easy to understand. It's not very exciting, but anything you want to know about Medicare is in here. So we're going to take all this information from here and fit it into the workshop tonight in a format that it's going to be easy for you to understand. Okay, so we're going to touch on this real briefly because the new Medicare card has been out for a couple years, but when you get that card, it's going to have your name, a Medicare number on it that's not like any other identifying number you have, and the dates that your Medicare A and B started. The important thing to know about this is you really have to keep an eye out for this card when you go on Medicare, because it comes in a little white envelope. It doesn't look like anything that's really that official. It doesn't look near as official as some of the ads that you're going to be getting, and we've had people throw it away, unfortunately, when they're doing their sort from the mailbox to the garbage can inside the house. So, when you're getting close to 65, make sure you're opening everything and make sure it's not something important before you throw it away. So who here tonight feels like this guy? Okay, they're standing in front of the maze with that lost look on their face. Well, we're here to help you through the maze. We like to joke that we have a map to the maze, and it's not so much a joke because we've done this so many times. We really kind of do know the easiest path, so we're going to help you. Okay, so the things that, again, we're going to cover today, we're going to cover Medicare Part A, Medicare Part B. We're going to go over Medicare Part C, which are the Advantage plans. We'll go over Medicare Part D, the prescriptions, and we'll go review Medigap as well. So a couple things. What exactly is Medicare? So it is health insurance for 3 groups of people, and it's people that are 65 and older, people under 65 with certain disabilities, and people of any age that have end-stage renal disease. And Medicare is run by the Centers for Medicare and Medicaid Services. In order to get it, you do have to be a U.S. citizen or lawfully present in the United States. Right now, there's about probably over 60 million people that have Medicare in the United States, and that's more than 1 out of every 6 U.S. citizens. So quite a few people are getting their health benefits from Medicare. Now, sometimes people use these words interchangeably. They're not the same thing, though. So again, Medicare is health insurance for those 3 groups of people we just mentioned on the last slide, where on the other hand, Medicaid, it's a joint program between the federal government and our state government, and it pays the medical costs for those people that have limited income, limited resources. And somebody that qualifies for both Medicare and Medicaid is called dual eligible. Again, both programs are run by the Center for Medicare and Medicaid Services. Okay, so getting into Medicare now, the parts of Medicare. So, and this is all there is to original Medicare, which is our Part A, which is the hospital care, and Medicare Part B, which is medical services. And that's all there is to original Medicare. Now, the thing that's important to take away from this is if you only have Medicare Part A and Medicare Part B, it's not going to cover all of your health care expenses. So later on in the workshop tonight, we're going to go over some things that's going to help you pick up the expenses for the things that are not covered by original Medicare. So our Medicare Part A, it's our hospital insurance. Okay, and you're eligible for 40 quarters, you can still get Medicare Part A. You just have to pay a premium for it. So what does Medicare Part A cover? So Medicare Part A is our hospital insurance. It basically covers hospital expenses, okay? So the semi-private room, your general nursing care, your hospital services and supplies, your meals, and all of your blood but the first 3 pints. Now, Medicare Part A also covers your inpatient mental health care, and they cover 190 days in a person's lifetime. The hospital insurance covers essentially 90-day blocks. So that means you would have to be in the hospital for 90 consecutive days and obviously very sick during that time. Now, if your hospital stay lasts longer than 90 days in a row, Medicare gives you an additional what are called 60 lifetime reserve days. So you could have theoretically a hospital stay up to 150 days in a row. But once you use those 60 lifetime reserve days, they're gone. You can never get them back. But the 90-day blocks of coverage keep renewing essentially once each calendar quarter. Now, there are some things that Medicare will not pay for, and that is private duty nursing and comfort and convenience items. Now, I always get the question, what's a comfort or convenience item? Well, if you have a TV on your wall in the hospital room, Medicare doesn't pay for that TV. So that kind of thing. Now, we told you a little bit earlier that Medicare A and B doesn't cover everything. So these are some of the gaps in Medicare Part A. So if you're in the hospital day 1 through day 60, Medicare pays all but the first $1,484 of each day. If you're in the hospital for longer than 60 days in a row, day 61 through day 90, now Medicare pays all but the first $371 of each day in the hospital. And if you're in the hospital day 91 through day 150, now Medicare doesn't pay for the first $742 of each day in the hospital. Okay, Medicare also does not pay for the first 3 pints of blood, regardless of where you get it. They will not pay for cost if you're in the hospital for longer than 150 days in a row. And again, they're not paying for the comfort and convenience items. Now, that $1,484 charge, if you're unlucky when you need hospital coverage, it could end up being due up to 4 times per calendar year. So remember, I talked about you had coverage in 90-day blocks. So say you go into the hospital in January, $1,484 would be due. If you go to the hospital again in March, you wouldn't owe it. But if you went in April, there'd be another $1,484 due. Now, if you only rely on Medicare Part A and Part B and don't have anything else, if you have very unfortunate and end up with a $150 hospital stay, you could end up with more than $55,000 due out of your own pocket. So it's real important to not just rely on Medicare A and Medicare B. Medicare Part A also covers your skilled nursing care as long as you follow some rules like a hospital stay prior to that skilled nursing facility need, and they will pay for the first 20 days at 100%. And after that, they pay all but the first $185.50 each day. And they only pay for up to 100 days. So after 100 days, you will be responsible for any additional long-term care costs. They're also not going to pay for assisted living. They're not going to pay for in-home care. This is actual skilled nursing facility care that Medicare covers. And that's, in a nutshell, basically Medicare Part A. So Medicare Part B, it's medical insurance, and this is what pays for the providers that give you that care. Okay, so this is your doctors, your physical therapists, anybody that you're actually providing that care to you. So for most people, how it used to work, your Medicare Part B premium was deducted from Social Security checks. Now, once you go on Social Security, that is exactly what happens. But what we're seeing today is most people are not taking Social Security at age 65. They're waiting till 66 and 2 months or some point past that. Some are even waiting the whole way to age 70. So during that time when you're not getting Social Security, Medicare is going to bill you for that Medicare Part B premium. Now, if you're one of those dual eligible people that qualifies for the state Medicaid program, then the state picks up the cost for the Medicare Part B premium. And this is one of the areas where we see people make mistakes and end up in trouble or having issues for the rest of their life. And for that reason, we're actually going to hit this on a couple different slides here today because it is very important. It's very crucial that you enroll in Medicare Part B at the right time, okay? Medicare says Part B is optional, but the only time it's optional is if you have coverage through your employer that qualifies as credible coverage. Okay, now what happens if you don't get Medicare Part B when you're supposed to? You're going to have a lifetime penalty of 10% for each full 12 months that you did not have Medicare Part B and you were supposed to. And again, that's a lifetime penalty, and that can end up being pretty significant. Now, the first time that you can get Medicare Part B is when you turn 65. There's a 7-month period. It starts 3 months before the month you turn 65. It runs the month you are 65 and runs for 3 months after. And during that period of time, you're able to enroll in Medicare Part B. Now, here's the thing. If you have employer-based coverage, you may not want to take your Medicare Part B. So you can delay enrollment in Part B and take advantage of a special enrollment period. And that opens up when you leave your employer-based group in coverage, okay? Or it also happens if your employer stops their coverage or you lose your job. You'll be able to get into Medicare at that Part B at that point without having any penalties. Now, if you missed your initial enrollment period, if you miss any special enrollment period that you're entitled to, there is one other time each year where you can enroll for Medicare Part B. That's called the general enrollment period. It runs January 1 through March 31 of each year. And if you sign up during that period of time and take advantage of that enrollment period, your coverage does not take effect till July 1st of that year. It's pretty much a guarantee if you're signing up in the general enrollment period because of that delay in coverage start, you're probably going to be facing a penalty also. Okay, so right now, 2021, the annual Medicare Part B deductible is $203. So you have to pay that first $203 before Medicare kicks in and starts paying anything. Now, after the $203 is paid, and then Medicare pays 80%, and you have 20% co-insurance. But that's just if you have original Medicare Part B, nothing else. Again, when to enroll in Medicare Part B. So that enrollment period lasts 7 months. Okay, if you enroll month 3, 2, or 1 before you turn 65, then your Medicare Part B will start the first day of the month you turn 65. If you wait till the month you turn 65 or after, your Medicare effective date could end up being delayed up to 6 months. So if you want Medicare when you first turn 65, you definitely want to get on that and start that process in the 3 months before you turn 65. Now, after this initial enrollment period or any time during or after, you can sign up for premium-free Part A, but you can only enroll in Part B during a valid enrollment period. And again, you will have that lifetime penalty of 10% per 12 months if you do not sign up during the correct time. One last time, and we'll move past this. For example, if your birthday is in the month of April, the earliest you could sign up for your Medicare Part B is January 1st. The latest you can sign up is July 31st. So again, during this period of time, you can sign up for any of the Medicare plans that are out there and available in your area. And that kind of wraps up the quick explanation of Medicare Part B. Next, we're going to jump into the prescription drug plans. We always get a lot of questions about this as well because the rules on this change every single year. And once you go on Medicare, there's only going to be 2 ways that you can get your prescription drugs. And one of those is if you keep original Medicare, you will get a standalone prescription drug plan. And that's how your drugs will come if you stay that route. Now, if you go with a private insurance company that has a contract with Medicare, you're going to be having a Medicare Advantage prescription drug plan, and it will have the drugs included right along with that plan. Okay, so who's eligible to get Part D? And that's pretty much anyone that's entitled to Part A and or is already enrolled in Medicare Part B. So that's pretty much everybody that's on Medicare A. Now, the important thing is you can only get a plan that's available in the area where your official residence is, where you vote, where you live. So in Western Pennsylvania, for example, where we're located, there are 30 plans, so you have to pick among one of those plans. If you go part of the year and live in another part of the country, say Arizona, Florida, and you see a plan there that you like, unless that's your official residence, you cannot pick that plan. You have to pick a Western Pennsylvania plan. The other thing here is those people that qualify for both Medicare and Medicaid, they can choose to enroll in any Part D plans available for them. And here's another penalty, okay? So if you wait to get Medicare Part D, okay, there is a 1% penalty per month for when you're supposed to have Part D until the time you actually enroll. So that's actually more severe than that Part B penalty. Now, there are some people that don't need to get Medicare Part D, and that's the people if you happen to have VA drug benefits, if you have employer benefits, if you're on a pharmacy assistance program, you don't need to get that. Now, all the time we hear people that are healthy at 65, they're not taking any medicine, they're maybe taking one medicine that costs $2 or $3 a month, and they say, well, why should I pay a premium for Part D? Well, you have to pay that premium. You have to get that plan to avoid a penalty, because the day will come when you need to take some kind of medication. You will need to get a drug plan, and then you could be faced with a 12% penalty. We even saw one person over this last annual election period, 96% penalty. They waited 8 years. Okay, so don't do that. There's no reason to ever have a penalty, whether it's for Medicare Part B or Part D. Just, do the right thing at the right time, and you'll be good to go. Now, these are how the Medicare Part D plans work for 2021. This is where we get all the questions. It's the most confusing part about how the drug plans work, and that's because they change these numbers and the percentages every year. Okay, so in 2021, how the standard plan is supposed to work, and these guidelines are set up by the Centers for Medicare and Medicaid Services, you're supposed to pay the first $445 of drug costs, 100% of that. However, in our area, most of the prescription drug plans, most of the Medicare Advantage prescription drug plans, they waive that deductible for your tier 1 and 2 drugs. So most times those drugs are going to cost $0 or a few dollars. Okay, once that $445 is deductible is satisfied, either you paying it or your insurance company waiving it, you're in the initial coverage phase over in that yellow section. Okay, and until the true cost of your drugs reaches $4,130, you will pay 25% of the cost of your medication. Once you go past the $4,130 in drug cost, you're falling into what used to be called the donut hole. Now, it doesn't really change that much in the donut hole because you're still paying 25% of the drug cost. In the past, the donut hole was a bad thing because you paid more than 25%. I mean, at one point you're paying 35, 40% of the cost of the drugs in the donut hole, you're still paying 25%. The only thing that changes now is who's paying that other 75%. And once the cost of your drugs goes past $6,550, and that's what the cost that you've paid and anybody else has paid, like the drug manufacturer, you are what's called the catastrophic coverage phase of your drug plan, and you will only pay at the most 5% of the cost of your medication. Again, that's confusing. That's a moving target. It happens every year, and we're glad to answer questions about it and go over that with you. So, and now we're going to move on to the area. I mean, we've gone on past the information about how Medicare works, and we're going to go over your choices when picking coverage. And this is why most of you have joined us this evening. You want to figure out, what you should do for yourself, what's going to be in your best interest. So there's a couple choices here, okay, in this area. And on the blue side, okay, that's if you choose to keep original Medicare. And and you're getting something else to pay those all buts that we talked about, to fill in the gaps that Medicare does not cover. So if you stay with original Medicare in that blue side and you have some employee or retiree group coverage, that may pick up the cost that Medicare does not cover. Sometimes those plans require you to have Medicare Part A and B, and sometimes they have drug plans, but you need to check that out. If you don't have the benefit of having an employer or retiree group plan, you can get a Medigap plan. Okay, they require you to have Medicare Part A and B, and you will need to get a prescription drug plan in order to have complete coverage. If you go the other route, you pick a private insurance company that has a Medicare contract to provide your care. That's what the Medicare Advantage plans are. It's a private company taking over for Medicare. Okay, those plans also require you to have Medicare Part A and B. And in our area, mostly what we see are HMO and PPO plans. Those plans, almost all of them, have prescription drugs included with them. The Medicare Advantage plans for the people that are dual eligible, they have those as well. They're mostly HMO plans in this area here, and again, they can include prescription drugs. Now, we talked about, making sure you head through that maze the right way, making sure you stay on the right path and don't make mistakes. Now, this is one of the points where we see two really common mistakes that people make, and we try to help you avoid them. The first one of those is, say you've worked at a company for 20, 25, 30 years, and you've had the same medical insurance company provide your care that whole time that you were with that employer. You're real comfortable with it. You know how the plan works with your doctors, and you make the choice, say, hey, I'm just going to pick a Medicare plan that company is offering as soon as I turn 65 and become eligible. Well, here's the problem there. So that plan that your employer bought for you with that insurance company, it's designed to cover a whole broad group of people, from people that are 21 years old, families that have children, the whole way up to older adults. And the coverage that it provides is not the same as what that Medicare plan is going to provide. And if you just blindly pick an option offered by that insurance company without verifying that it has all the benefits you need, you could be in for a rude awakening when you go and try to use that first day after you turn 65. The other area where we see a person make a wrong turn or mistake is, say you have a friend that's done this whole Medicare thing a couple years before you have, and I don't know if we have anybody named Sally on here today. That's normally a name we like to pick on, and if your name is Sally, I'm going to apologize to you in advance. We're not picking on you. It's just a real simple name. But say your friend Sally has gone through this before, and she selected a plan, and it's worked real well for her, and she really likes it. And she's kind of forceful, and she does a good job of convincing you. You should get that plan as well. So you go with Sally's plan, and you sign up for it. And come January 1st, you go to your doctor, and guess what? He doesn't participate. And then you're traveling with to see your grandchildren, and you have a medical need there. You need to see a doctor. There, you can't find any doctors there, so that's a problem. Sally picked a plan, and her doctor is 2 blocks away. The hospital she goes to is a mile down the road. She doesn't travel anywhere. She's lucky if she gets to downtown Pittsburgh a couple times a year. Where you, on the other hand, you don't like Sally's doctor. You go to a totally different health system, and you travel all over the country for vacation, enjoyment, and to see your grandkids. So your needs are different than Sally's. The other thing is, we maybe have 30 or 40 people on this workshop tonight. Not one of you take the same exact mix of medications. None of you probably don't see the same doctor or use the same health system. So again, it's important to pick and look at the features that of each plan. Make sure your doctors and health system participates, because if you just pick Sally's plan, you're going to, again, a rude awakening, and we don't want that to happen. So next thing we're going to jump into is Medicare supplement insurance, okay? And so here's how this works with the Medicare supplement. We're going to call it Medigap. In our area right now, we have 60 carriers that have the same exact plan G, okay? Now, if you're writing anything down, taking notes, you can write this next part down and underline it and just keep it in mind for something I'm going to say a little bit later in the workshop. So regardless of the plan letter, all insurance companies are required to offer identical medical benefits. So if we're talking Plan G, and we use Plan G in our presentation because it is the most comprehensive, and probably 97% of the people we work with go that route. Okay, so regardless if you pick company number 1 or company number 60, those Plan G benefits are going to be absolutely identical. There are 9 different plans that are offered, but again, most people gravitate towards Plan G once they look at the benefits. The plans sold are identical in 47 states. There's 3 states that don't follow along, and since nobody really is planning on buying a plan in Minnesota, Wisconsin, or Massachusetts, we're just not going to get into it. Next chart can be a little bit confusing, but this is going to be coming in that Medicare and U book I showed you, and probably almost every piece of mail you get, but it's a breakdown of what each of those 9 plans will cover. Okay, so and each of the columns going down on that far left side where it says benefits, it's one of those areas where Medicare A and B does not pay 100% of everything. It's a gap in coverage. So what we're looking for is the most check marks in those gaps. And if we're looking at Plan G, we can see that there are check marks the whole way down, except when we're looking at that Medicare Part B deductible, and that's the only thing it doesn't cover. And this year, again in 2021, that's $203. So if you have Medicare A and B, you get a Plan G, your out of pocket is going to be limited to $203, and that plan will pick up the remainder of the expenses. So next, we're going to jump into our Medicare Advantage plans. And we are in Western Pennsylvania. Some of the numbers we're using are, primarily Western Pennsylvania numbers, but the basics of what we're saying are still going to apply whether you are outside of that area or not. So right now, 2021 in Allegheny County, we have 7 carriers and 45 plans, and in Butler and Westmoreland, we have those same carriers except for 46 plans. Now, we always like to say we are blessed in Western Pennsylvania, and we're cursed at the same time. We're blessed because we have 2 really good health systems. We have 7 carriers with a lot of good plans. We're cursed because there are so many choices. It's hard to sort out. Most areas of the country, they're lucky if they have 20 plans. I mean, we looked at plans in California for somebody a couple months back that some areas only have 10 or 14 plans. So we have the benefit of getting a plan that's maybe really precisely tailored to what you need. It's sometimes hard to figure out which plan that is, though. So there are only certain times when you can get into one of these Advantage plans, and the first one of those is during that initial election period. It's the same as when you initially are entitled to your Medicare A and B the first time. Okay. The next time is you can change these plans once a year, October 15th to December 7th. And you'll know when this is because pretty much if it's not during an election year, every single television commercial is going to be about some kind of health plan that has great benefits that you should sign up for. Okay, just a lot of confusion is going on there. During this annual election period, you can change from original Medicare to an Advantage plan. You can change Advantage plans. There will be no health questions asked, no qualification during this period. Now, there's another period, and this is just for the Medicare Advantage people, that runs January 1 through March 31st. And during that period of time, you can switch one time. Now, say, for example, you listened to Sally, you signed up with her plan, and you figured out on January 5th it's not a good fit for you. You can change to another plan one time. You can also go back to original Medicare. You can leave a Medicare Advantage plan and go back to original Medicare. Now, something that's important to know here, if you're planning on getting a Medigap plan, there's a period of time, that initial enrollment period with those Medigap plans, there will not be any health question. They have to accept you regardless of how unhealthy you are. But after that initial enrollment period, The gap plans can ask you health questions, and they can refuse to enroll you if you have medical conditions that they don't like. So if you're in this annual open enrollment period and you want to go back to original Medicare, you absolutely have to make sure before you make that switch that you find a plan that's willing to take you into it. Okay. And there's one other time where you can change your Medicare Advantage plan. I talked about those plans that are available in Western Pennsylvania. So say if you move out of this coverage area in Western Pennsylvania, say you move to the eastern part of the state, you move to Arizona, you move to Florida, you have to get a plan that's available in that area. You'll have a limited period of time to make that switch. And again, when you make that switch, they will not ask you any health questions. The only other situation, and it happens not too frequently, but it does happen, sometimes an insurance company will say, hey, we're not going to offer coverage anymore after June 30th, and you will be able to select a new plan without any health questions if that happens to happen. Now, let's compare. I mean, that's what people always want to say. Why should I do Medicare and a Medigap plan? Why should I do a Medicare Advantage? So we're going to kind of break that down for you, why people go one way or the other. And there's not one side that's better than another. It's what's the right fit for you. Now, the reason people that will go with a Medicare and a Medigap plan is any doctor, any hospital in the USA that accepts Medicare is going to take those plans. So pretty much freedom of choice of any doctor that's available out there. On the other hand, Medicare Advantage plans, they will have a network. It could be a limited network. It could be pretty broad. If you select a Medicare Advantage HMO plan, it will require you to stay within that network. Whereas PPO plans, they'll let you go out of the network as long as you agree to pay a little bit more. Now, Medicare and a Medigap Plan G, there's no copays. Okay, with the Advantage plans, they are shared expense plans. There will be some copays depending on what procedures you have done, what your health care needs are. Medicare and Medigap, you will have to pay that Part B deductible. The Advantage plans, you will not have a deductible in most cases. Most of the plans that we look at and see have $0 deductible. And with the Medicare, Medigap route, once you pay the deductible, there's no more out-of-pocket. With the Advantage plans, the out-of-pocket, it's going to vary based on the plan and based on what your medical needs are. They are shared expense plans. With the Medigap route, you will have to add prescription drugs. With the Advantage side of the equation, the prescription drugs are usually already included there. Now, the most popular reason somebody would select a Medicare and a Medigap plan is the freedom of choice. People tell us they don't want to have to worry about a network. They want to be able to go to any doctor, any hospital in the U.S. They like the fact that they don't have to worry about figuring out what their copays are. And there are no referrals required. We see people go this route if they have some significant health things going on, or if they're a stickler for running a budget and they want to know what their monthly health care expenses are. On the Advantage side, the reason people select those, number one is the monthly premiums for the most part are much lower. They are shared expense plans, and the people that like this, they are fine sharing expenses when they actually need care. They may hardly ever go to the doctor. They may have don't have a family history of medical needs, so they figure that when they do have to get some care, the cost is not going to be that great. They like the fact that doctors and hospitals they already use are part of a network that's within that plan. They like that the prescription drug benefits are already included, and for that reason, they like the fact that in their mind, they're simpler to use. So what I'm going to talk about now is unbiased advisor versus an insurance company. Now, something I didn't say at the beginning, I usually do, is right now we represent all of the carriers in our area. So regardless of who you're looking at, we're going to have information and facts about that company. We don't really care which company you go with. We are unbiased, okay? So, I mean, when you're making your choice, I think that you need full information, you need full disclosure, and to know all of your options and have them laid out in front of you so you can make the best choice and end up with the best coverage and hopefully the lowest cost. Now, if you go with an unbiased advisor, they're going to have information again on all the plans, whether it's Medigap, Advantage, prescription drug, and they'll be able to look in each carrier's system and see what's offered. Now, if you go right to an insurance company and call their call center or walk into one of their stores or kiosks in the mall, if you want to go that route, or go to one of their presentations or webinars, you're only going to hear about the plans that they offer. Okay, so your knowledge and of what's out there is going to be limited to what they show you. Unbiased advisor is going to discover what's important to you. What doctor you want to go to, where do you want to travel, keeping your medication costs low important to you, those kind of things. So they're going to discover your personal needs. Okay, on the other hand, the insurance company, they may see how close they can come to what you're looking for. Chances are they're not going to have exactly what you're looking for, and they're going to maybe convince you that you should make a compromise when it comes to what your health needs are. Once the unbiased advisor has figured out what's important to you, then they'll come up with a personalized coverage plan and help you select the best options from all the carriers out there. On the other hand, that insurance company is going to be limited to the plans that they offer, and you only know about the plans offered by that company. You'll get to know what your options and choices are with an unbiased advisor. You can compare plans. You can say, well, what if I move to a different part of the country? What if my finances change and I need to cut costs? All those things can be run by the unbiased advisor. Whereas if you go straight to an insurance company or one of their captive agents, you're not going to get any comparisons. And here's something important. They're not going to share information with you if one of their competitors is offering a better plan. I kind of compare this as to if you're going out car shopping. Say you're in the market for a new truck and you find yourself on the at a Ford dealership on the lot talking to a salesman. That guy's going to tell you, or that girl's going to tell you everything possible that's good about that Ford F-150 and why it's the best truck for you. They may not tell you that you want to tow a boat or camper and Dodge Ram might be better for that. You may need some kind of special feature like a special tailgate that's better on the GMC. You're just not going to know about that. The Ford dealer is going to tell you what they want you to know about that Ford F-150. The other thing that unbiased advisor will do, annual personalized follow-up. How did your plan work for you last year? Has your situation changed? Have you had some good or bad changes in your health? Has your medication changed? Is there a better plan out there for you? Whereas an insurance company, what's going to happen is you're going to get a letter describing to you how your plan is changing for the upcoming year. Okay, is the cost going up? Is the deductible going up? Is the out-of-pocket max going up? That's all you're going to find out directly from dealing with an insurance company. The other thing that we see a lot sometimes, or people get into a little bit of an issue, is they fill out something online, they send in a postcard, and somebody calls them, sounds really official. It turns out that advisor is calling from Florida, Arizona, Wisconsin, you name it. They have a big call center there, and they're calling from that out-of-state call center. So, with us, we've been in Western Pennsylvania for years and years. We have years of local experience. We're located right here in the North Hills, right off of McKnight Road. And we know the experiences that our local clients have with all the insurance companies. We know if somebody has issues calling into a company and they have to wait on hold 45 minutes, an hour. If they're dealing with somebody where they can't maybe understand that person on the phone, we have that knowledge and information because we're always following up. And we'll share that with you. And if there's two plans that are comparable, we'll say you're going to have an easier time with plan A over plan B. Now, that guy that's distant and out of states, he sells plans in all the states, okay? So he's not going to know what the local plans are that the people in our area like and what works best here in our area. Again, we're going to have access to information on all of the local plans. We offer coverage through any company that you want to sign up with. And again, we don't care which plan you select because all plans have good features. It's important that you're in the best plan for you. Again, that distant advisor may only have access to a few companies. And again, they're going to tell you about the plans that they have available and the one or two plans that they really know, best. Okay. Working with a local advisor, when somebody's here working with us, we can show you the details for all the plans. Okay, we can show you as much detail or as little detail as you want, and we're paid the same regardless of which plan you go into. So we have no financial incentive to push you one direction or the other. Again, we want to deal with you for years and years. We don't want this to be like a one-night stand. This is an engagement. So that distant advisor, again, okay, is going to have a limited choice of plans. There may be some kind of incentive to not mention one carrier over another. Here's the important thing. You can find us. If you want to come to our office, we're glad to have you here. We probably have way more than 90% of the people come here and work with us. You can sit down, have a cup of coffee with us. We'll go over this, find out about you, what's important to us. We can come to you. We can work virtually. We want to make it easy. But the important thing is when you need something, you know where to find us. Okay, that guy that's calling you, they may be 1,000 miles away. Where the heck are they? You just don't know. And, they have turnover of agents. We've been here a long time. The agent that's been here the least amount of times, 2 years. So, people stay here, and you're going to recognize the faces when you come back, okay? And that's important. So we're going to know what you had last year, the year before, and 5 years from now. Again, there's that annual personalized follow-up. If things have changed, plans have changed, and that's an important detail to mention. Sometimes nothing may have changed with you at all, but how a plan pays for drugs may be drastically different, and it could end up costing you thousands of dollars more. They may have raised the out-of-pocket max to the highest amount allowed by Medicare, and you may not really have caught that when they send that around, and there may be another plan where that's $3,000, $4,000 less, and you need to know that. You need to be aware of that so you can make the best choice. Again, that distant advisor, there's not going to be any follow-up. The only reason they may call you is if they have something else that, a different type of plan that they're trying to sell. What's this going to cost? That's probably the number one question. People are kind of worried. They're confused about the cost when they go on Medicare. So we're going to compare these two routes side by side, whether you're sticking with original Medicare and getting a Medigap plan or whether you're going with a Medicare Advantage. So for Medicare Part A, the costs are identical whether you have Medicare and a Medigap or Medicare Advantage. Part A is $0 for most people. Okay, Medicare Part B, they both require you to have Medicare Part B, and for the vast majority of people, that Medicare Part B premium for 2021 is going to be $148.50. Now, if you do make above a certain level, and it's a pretty a high number there is a surcharge based on your income. If that's something you're worried about, shoot me an email, get in touch, and we will be glad to answer those questions for you about that surcharge and maybe some things that you can do possibly to avoid that surcharge or get it ended early, okay? Because we do have people that some strange things happen to them. They come into an inheritance, they win the lottery, and it makes that surcharge go up for a year. Well, you want to get it knocked off your plate as soon as you can. Okay, so Medigap Plan G, okay? So the range of Medigap Plan G in our area is mid-$90 the whole way up to over $300. Now, if you remember that thing I told you about earlier on, circle, underline for later on, the benefits are identical with Medigap Plan G, whether you're paying $95, $110, or $301. Question I always ask and always hear is, why would someone pay $300 when there's something identical out there, same quality, same benefits for $110? My answer is they weren't told about it. They weren't told about the plan that was less expensive and offered the same benefits. Over on the Medicare Advantage side, So the great thing is the premiums are low. There's plans that are low premium. Some plans have no monthly premiums for decent benefits. But over there, the plan premiums run from $0, again, the whole way up to over $300. And this is the thing that's kind of screwy with the Advantage plans. Most people think, common sense tells me that a $301 plan is going to give me better benefits than a plan that costs $40 or $29 or $0. Well, that's not the case. I mean, there are some plans in, say, the $20 to $50 range that blow away the benefits of that $300 plan. And again, it makes no sense, but you have to have that information to make sure you get the most benefits and don't overpay for them. On that Medigap side, Medicare Medigap, you will have to pay that Part B deductible at $203. It's not there in the Medicare Advantage plans. You will have to pay Medicare Part D premiums, and those start around $7 and can go up over $100. They vary based on your drugs. That Part D premium is wrapped into the Medicare Advantage premium, so you don't have to worry about it. So what's the bottom line? So the Medicare Medigap side, you have your $148.50 a month. If you have your Medigap premium, if you go to the doctor, your $203 deductible, your drug cost. So there's going to be a number there you can figure out pretty easily and add up and plug that into your budget. It's a little bit more difficult on the Medicare Advantage side. It's going to depend on how often you need to go to the doctor, if you need hospitalization, and your prescription copays. Now, if you're basically pretty healthy and don't go to the doctor a lot, that might be easier to figure out. But again, there's no guarantees there. There's no crystal ball that says you're not going to have to go to the doctor. So, I mean, you can kind of figure out the cost, but it's not going to be as precise as that Medicare Medigap side. So we told you earlier that it's important to enroll in Medicare at the right time. Okay, so when should you enroll in Medicare? And there's three situations. The first is if you're still working and you're covered under your employee group plan. Second situation is if you're collecting Social Security benefits already. And the third is if you're not collecting Social Security. Now, so if you're still working and covered under employee group insurance, these are your options. Okay. Option one is to stay with your employer or group insurance coverage. Delay enrollment in Medicare, and there will be no penalties, no loss of options when you finally do come off your employer plan. Okay, you just have to have a simple 2-page form filled out by Medicare, or your employer, and send that off to Medicare when you're ready. And up to about 3 years ago, this is normally what we recommended. I mean, the group plans offered by employers were pretty good, okay? But if you want to leave your employer plan, you can leave your employer coverage. You can enroll in Medicare and select either a Medigap or Medicare Advantage. Now, what we've seen start to happen about 2 years ago is the cost sharing with the employer plans. And that means the amount that's taken out of your paycheck to help your employer pay for your group insurance started to go up, started to get pretty high in some instances. Sometimes the deductibles before the insurance company paid got to be pretty high, $1,500, $2,500. Some high deductible plans are the whole way up to $5,000 that you have to pay out of pocket before the plan picks up anything. And then the co-payments and deductibles and out-of-pocket max just weren't that good. And at the same time that was happening with employer coverages, the Medicare plans got really good, and it became less expensive to go on Medicare even though you had employer coverage and enroll in some kind of Medicare plan. And in many cases, that was the case even if your spouse was not old enough for Medicare yet. It was still less expensive to put them on an ACA plan, an Affordable Care Act plan, or a plan through the marketplace. In some places, it saved people a whole lot of money, and they got better benefits. And this has also turned out to be the case. Unfortunately for the people that are, federal employees, a lot of school employees that have plans through the, health plans through their pension or their union, even those plans have gotten more expensive. In most cases, it costs less money to take Medicare on your own and get some kind of Medicare plan. So in that situation, again, you need to make sure that that's the right choice for you. Make sure your spouse or dependents can get coverage that's less expensive before you leave that employer plan and take Medicare. Now, probably the easiest situation is if you're already collecting Social Security. Now, what happens if you're already collecting Social Security? You're going to be automatically enrolled in your Medicare Part A and B. 3 to 4 months before you turn 65, you will get that Medicare card we showed you at the beginning that has your Medicare A and B start dates with it. Now you have a choice, okay? So if you have some kind of retiree or employer group insurance, you're still working, you can delay that enrollment in Medicare Part B. So you're going to turn your Medicare card over, check a box on the back and sign it and say you want to delay Part B and send it back. You'll get a new card with Part A. But again, you want to make sure that you're getting all the benefits you should with that employer plan. You're not paying more than you would to get better benefits on Medicare and with a Medicare health insurance plan. And if that is the case, if it is costing you more, you can go ahead and get that Medigap or Medicare Advantage and keep your Medicare Part B. Finally, when should you enroll in Medicare if you're not collecting Social Security? And we are seeing this more and more. Fewer people are taking Medicare at 65. They're waiting until their full retirement age to get that full amount of money that they are entitled to. They're waiting longer. So in this situation, and especially with everything that's going on with the pandemic, with federal offices being closed, we strongly recommend that you go to the Social Security website at least 90 days before the month you turn 65. And that website is www.ssa.gov. And you want to look over on the right side. There's a big box there with a picture of people in it. It's kind of blue colored, and it says Enroll in Medicare. And you want to click that and follow through with the steps to do that. Okay, now if you have any thoughts or fears, or you're not confident that you can do that yourself and are afraid that you might make a mistake, we're more than glad to help you with that. We do that 5 to 10 times a week for people. We take them to that Medicare site, get them signed up for Medicare at the right time. Now, we don't recommend waiting till 30 days before. We don't recommend waiting till 2 weeks or the week before, because it doesn't happen often, but there can be problems. Okay, Medicare or Social Security could have something wrong with your Social Security number, your birth date could be wrong, your account could be locked because somebody tried to go in and be an identity thief. So you want to get in there and find out those problems beforehand so they can be corrected, and you can start Medicare on the first day that you want it to start. So, and normally if we start 90 days before, that gives us ample opportunity to get through all of those problems that we've seen people encounter. Again, you want to do that 90 days before the month you turn 65. The important thing you want to do is you want to print that final screen that has your reentry number. Okay, there will be an option to print that screen. Please do it. Save it, that copy, in a safe place. Make 2 copies. When we do it here in the office, we print 3 of them. We give 2 to our client, and we keep 1 in their file, so there's always verification, because that reentry number, it'll have the date on it that you applied for social or your Medicare benefits. Now, if we can't verify that you applied for your Medicare benefits, you could be facing that Medicare penalty, and we don't want you to do that. There's no reason you should do that. And there have been people that have done all the right things on their end. They enrolled in Medicare when they thought they should. When it came time for them to take the benefits, they found out they weren't enrolled, and we've had some people have an 80% penalty. So you want to make sure that you print that verification, so it's very easy to say, hey, I did this when I'm supposed to, and the penalty goes away. If you don't have it, it's almost impossible to prove it, and unfortunately, the penalty's there. Now, once you've enrolled in your Medicare, you have that option of selecting your retiree or group insurance if it's still available, or taking a Medigap or Medicare Advantage plan. Now, these are some helpful websites. They are all government websites, and they do have a lot of good information. The first one is Medicare.gov. And it's going to have every bit of information, every regulation on there about Medicare, and it's a good site. It's useful, but I'm going to tell you the same thing there as I did about that 128-page book. Sometimes it can be difficult to find the information. Sometimes looking for the information is boring. It's boring to read, and just not easy to pull that out. But again, good. There is good information there if you know how to get it. The second is mysocialsecurity.gov, and on that My Social Security site, you'll be able to see all the benefits you've applied for your Social Security, when you applied for Medicare, what your Social Security benefits are. Again, it's a very good site. It has useful information on it. The final one is mymedicare.gov, and I do strongly recommend once you go on Medicare, you go to this site, set up your My Medicare account, because you will be able to track your doctors. If you forgot when you've seen a doctor, forgot what prescription you've had filled, that information will be available on there. And it's really a wealth of Medicare information that's specific just to you. So again, set that up and take advantage of that site. Okay, so we are getting a little bit closer to the end of our workshop this evening. I'm sure you all remember this guy from back at the beginning, okay? We know Medicare can be confusing. We hope that the things I've covered in this workshop tonight will make your Medicare journey easier. I know that you still have a lot of decisions facing you, and even though you don't know the exact path through the maze, you know there is an end on the other side. And even if you're not confident that you can, get through without backtracking, we're here to help. Well, I do want to let you know that we're here to help you get to the other side of that maze. Okay, something we like to joke about. We show this picture. This couple has crossed the finish line. We say that because we have the map and they've worked with us. And something that's, we have a large group of different ages here tonight, people that may be a month from Medicare, that may be 6-8 months from Medicare. We don't care when you are. It's not too early to start, looking at these options, getting an idea of what you want to get your plan in order. Because the thing that I can tell you, as soon as you make a decision, it's going to give you a good, confident feeling inside. It's going to take away a lot of the worry. I mean, I know you're getting stacks of mail. The closer you get to that 65th birthday, all the mail's confusing. It seems to contradict each other. There's confusing commercials on television that are, basically verge on being misleading, and as soon as you make that decision, you can not pay attention to that anymore, and it's, again, you're going to feel a lot more confident, a lot more happy. Now I'm going to talk a little bit about how we work with people in just a second, but I'm going to share with you some of the reasons why I think what we do is different, how we do approach this is a little bit different. Sometimes, you're working with somebody, they're going to look at you and say, hey, this is a good plan for you. Well, we have some exclusive technology to make sure that we have all the information to put you in that best plan. We're part of a much larger organization. We have offices nationwide in over 40 cities. We have probably at this point more than 900 advisors nationwide. And thankfully, for us, our home office has developed this great technology for us, because this job would be impossible to give you the detail and the information if we didn't have this available. So kind of what we do is we're going to find out who your doctors are, who your specialists are, what hospital you want to go to, what your drugs are, where you like to travel, all those kind of things. And we put that in the computer, and our computer tells us what plan's going to match those benefits you're looking for at the best price. It's even going to tell us what your prescription should cost for the next year, as long as there's no changes. And it gives us the green light. If you see those little green dots looking down the screen, that means all your doctors are in network, and this could be a good plan for you. So again, we have that exclusive technology. As far as I know, nobody else has this detail. We've had people come into our office and interview with us. They see this, they're amazed that this is out there and that we have this. We take it through a second step. We have another set of technology. We can go and actually look at the ratings of all the insurance companies out there. We can see their health. We can see their premium increase history. We can see how many people they have in Pennsylvania enrolled in the plan. So I mean, the more people enrolled, the more rate stability there should be. And say you go to an advisor and he tells you about these two plans, they're both about $138. Well, guess what? Nationwide, this one plan only has 368 people enrolled, and in Pennsylvania, they only have 5 people enrolled. Do you think there's a better chance of that plan raising the premiums as opposed to another plan? Excuse me, they had 720 people in Pennsylvania. So we have that kind of information available to you. And so how we do things different, we're going to present details of all the choices that we recommend. Again, we'll show you as much detail or as little detail as you want. We represent all the companies, again, so we're unbiased. We don't care which one you pick with. I said earlier, we want you to come back year after year because you like what we've done and you enjoy the service, you enjoy what we've done for you, and you've told your friends. That's the kind of relationship we want to build with you. So what we do is we offer everybody that comes to one of our workshops a Medicare Done For You visit. And your cost for that service is $0. Now, here's the funny thing that we've come across. I mean, we have some guys here in the office, been with us for a while, and they've gone through this thing that you're going through now. They've made this Medicare decision. You know, and they're Medicare and financial geeks, just like we all are here. And they've watched all these presentations and workshops out there. And the amazing thing that we found from them doing that is there are some companies out here that do this same service. They offer you to do something similar to Medicare Done For You. Excuse me, please. And they will charge $500 for that Medicare Done For You service. And then they'll send you on your way to get enrolled with some company. And then they charge $250 for that annual review. Again, that's a no-cost service. Well, the question we always get asked, whether we're in a library doing this live in front of a group of people, whether we're in a community center or where we do one of these virtual webinars, how can you do this? And if somebody else is charging $500, you're doing it for $0. Well, here's the things. When we represent all the carriers, they pay for our services of when we help you, and then we actually process the enrollment for that insurance carrier. When you decide to sign up with one of those companies, then the insurance company will compensate us for those services. Again, so that's a no-cost service to you, and the insurance company is going to take care of that. Now, we're coming to the end of the presentation. Again, I hope the information has been useful for you. We again are glad that you could join us tonight, and we are offering that complimentary Medicare Done For You appointment. The thing that I didn't go over is when you schedule that appointment, we have this nice guide here. It's Navigating Medicare. It goes over everything we went through in the workshop this evening. Kind of takes everything in that 128-page Medicare and You booklet and gets it down into 20 pages. So again, we work with all the local carriers. We don't care which one you sign up with. Again, we want you to be happy. We want you to come back year after year. Now, I'm going to open this up for questions here in just 1 second. Okay, so we have the question list enabled, and I'm going to, and want to make it easy for you to get in and schedule with us. So I'm going to have a way for you to get in our schedule right at the top of the screen. Okay, there's going to be a Schedule Now button. You can go ahead and click that. Or, like I said, you're going to be getting an email with a link to this workshop, and you will be able to contact us through that. You can call us, where we will display a screen at the end of how to get in touch with us. Okay, Bob. Thank you for that question. So your question is that $203 per year? So I'm guessing that what you're asking about is that Medicare Part B deductible, and that is correct. That deductible is $203 per year for that Medicare Part B, if you only have Medicare alone and nothing else that goes along with it, or a Medigap plan. So, if you go to the doctor 1 or 2 times at the beginning of the year, as soon as that $203 is satisfied, then there won't be any more Medicare Part B expenses with a Medigap plan. If you don't have a gap plan, then you will be responsible for 20%. Okay, Alice. Okay, so you currently have an HSA. Can you still maintain one in a Medicare or Medigap plan? Okay, so here's the thing with your HSA plan. You can maintain that present plan that you have, but you cannot make any new deposits into it once you have Medicare Part A, okay? Because any deposits you make in that HSA within 6 months of taking Medicare Part A are no longer tax deferred. They're no longer treated as being tax deferred. They will become part of your taxable income. You can still make that deposit into that HSA, but there's absolutely no advantage to do that. Now, however, you can pay for some of your Medicare expenses with the funds that you presently have in your HSA. So you don't have to liquidate it, but you can use it to pay for co-pays. You can use it to pay for, certain drug co-pays and things like that once you go on Medicare. Now, and again, I want to let you know if I don't answer your questions completely or exactly, then please, just prompt me there. Just say, this is what I really meant, or can you clarify this one part for me? I'll be glad to do that. Okay, so Joe, okay, that's an excellent question. Okay, are there any penalties if you're covered by your spouse's insurance plan through work? Okay, so Joe, so the good news is as long as you have that spousal coverage and it's credible coverage, there will not be any penalty whatsoever for you to keep that plan. You can delay your enrollment in your Medicare Part B, and when it comes time for you to leave that plan, you just have to get your wife's HR department to fill out a form saying you had the coverage, and you enter into that special election period where you can get your Medicare without any penalties, okay? But again, real important, and we're happy to do this. We urge you to look at what your spouse is paying for that coverage, okay? We want you to look at what the deductible is, what the copays are, and that out-of-pocket max. But because we're seeing probably very easy 90% of the time, it makes more sense for a person to take their Medicare benefits and get some kind of Medicare plan. Especially this year in 2021, we've had some plans come out with awesome benefits that we don't know how they do it. Hopefully that answered your question. So you're still working. Is there a penalty if you don't sign up for Part B? Fred, okay, so as long as you have credible coverage through your employer, there will not be a penalty if you keep that employer coverage. Okay, I hope that cleared that up. Okay. Okay, Brad, that's an excellent question. Do you have to tell Medicare that you are not going to enroll because you're covered with your company plan and not retiring? There's no requirement to tell them, but what we like to recommend is that you do go in and accept Medicare Part A as soon as you're eligible at 65. Reason for that is it doesn't cost anything to have your Medicare Part A, and in some cases, in a case of a hospitalization, that Medicare Part A can pay some part of that high deductible that you would face under an employer coverage. So take that Part A, get a Medicare account established, and then you can delay Part B right on the same at the same time as you're applying for that Medicare Part A. Okay, does that make sense, Brad? And you can say yes or no. Okay. Fred, how do you figure out if your doctors participate? Well, this is probably one of the hardest things, Fred, and that's an excellent question. It's the hardest thing for people to do on their own because sometimes the information you get from trying to go through the Medicare site is not accurate or up to date. Now, that specialized software that we have that is kind of exclusive to us, I mean, it goes a long way towards telling us whether all of your doctors participate. There's a funny thing that comes up a lot that I didn't mention when I was back on that screen. A doctor may practice in 4 or 5 different offices, but they may only accept a particular insurance coverage in one of those offices. And you want to know that they accept that coverage in the office that's closer to you, not at the one that's the whole way across town, across 2 tunnels and 3 bridges, okay? So, and we can find that out. And then from there, we also do a second level of checking, go directly to the insurance company and see if that doctor participates. Because, I mean, you can call your old doctor's office. Hopefully their staff member will be able to give you a correct answer. I mean, those people are overworked. They have a lot put on their plate, especially with everything that's going on now. And sometimes they're not able to stay entirely 100% up to date on the insurance plans that their doctor participates in. Okay, Colleen, thank you so much. So you made an appointment for your meeting. What I will do is I will be in touch, or one of my staff members here will be in touch, and we'll make arrangements for you to come to us, or if you're liking or desiring to come to our office. We are in the North Hills, right off McKnight Road, real near McCandless Crossing, North Park Lounge, Passavant Hospital, but we'll get you exact directions, and we really do look forward to seeing you and happy to have you. Okay, so Nadine, okay, so your husband's 64, you will be 65 in November. You're covered under your employer coverage till you reach 65, and you're curious about what your husband can do to get you through the 6-month gap. It's an excellent question. We run into that all the time. So what we'll do in that situation is we will look at the marketplace. Okay, so in Western Pennsylvania, in the marketplace right now, there's only 2 companies that provide coverage. One is Highmark, the other is UPMC. So that's a situation for the underage coverage, and we would look at what we can do to help you out in that situation. And we're glad to help, but I mean, that's the options that are there. Most of the other plans, like the short-term medical plans, you pay a lot of money, you get no real coverage. They're great for a catastrophic situation. And good news is with those plans on the marketplace, the price on those has come down quite a lot over the last 4 or 5 years. So, and again, we're glad to help somebody turning 65 get on the best plan for them, help them, their spouse, look for the most comprehensive, least expensive pre-65 plan, and then get them on the right plan at the right time as well. Okay, any other questions? Fred, can you help you sign up for Part B? Yeah, we're glad to do that. You look at that the first time yourself, it can seem kind of confusing, especially if you get an error message, but we do it on our screen here in our office, in our conference room. We can do it, share screens and do it virtually if that's how you want to do that as well. And we can get most people through it in about 10 minutes. It's, like I said, when you do something all the time, it's pretty simple. Nadine, you're welcome. Glad to help with that. Again, we'll stay here and answer questions as long as you want. I do want to remind people we have the Navigating Medicare booklet. If you need help. So Alice, do we have agents in Central Pennsylvania? That is an excellent question. We do not have agents in an office in Central Pennsylvania. A lot of our agents will travel to that area and help people. I mean, I myself probably have 100, 150 people in the Altoona, Johnstown, and in that corridor there, and I have people as far north as Kerwinsville, the other side of Tyrone. So yeah, we're glad to help, and we're familiar with those plans there as well. Again, we can do something virtually. And like I said, I have enough clients in the area. We have other advisors that have enough clients that we know those plans almost as well as we know Western Pennsylvania plans. Okay, well, Bob, thank you. I'm glad you could join us. You scheduled an in-person appointment. I'm looking forward to getting you in. We will follow up with you and firm that up and get you directions and let you know how we can see you. Again, do we have any more questions tonight? Because we're more than happy to answer questions. The thing that I want you to know as well, because sometimes you think think of something later on. I'm famous for doing this. I'll be driving away from somewhere and say, I should have asked that. Okay, so you're more than welcome to give us a call, shoot us an email, and we'll be glad to answer that question. we're going to follow up with you a way to get in touch with us when this workshop ends. You'll have a way to access a recording of tonight's live webinar. So if there's something you didn't get, something you want to review, you'll be able to watch that again and again answer questions. Alice, thank you for that kind compliment. We're glad that we can help. And again, look forward to helping as many people as possible. It looks like the questions are winding down. Do see someone typing, Colleen, okay, so looking forward to seeing you on February 2nd. That's going to be here before we know it. See you then. And as we're winding down, again, I want to remind people, when you schedule a live virtual appointment, we will get this Navigating Medicare workbook to you that goes right along with our workshop. Joe, thank you. Be in touch with you. Again, look forward to you being in touch with us. Okay. One last call for the questions this evening. Look forward to seeing you all, helping you with Medicare. It's what we really like to do. Like I said, we are Medicare geeks, and I hope you appreciate that excitement when we work with you. If there's no one else, no other questions this evening, or if somebody is a little bit slow to type, again, get those to us. We will be glad to answer those for you at any time in the future. Thank you for attending our Medicare 101 workshop this evening, Medicare Made Simple. Be safe, be well, and we're here for you when you need us. Thank you again.